started today. We have a few statements that are prepared from some various organizations, and we can hold all questions until those statements are done, and then we can jump into questions for any of the speakers that are here or any of the other agencies that are here as well. Obviously, Pitt County government is represented, public health, emergency management, Pitt County schools, Pitt Community College. I do think we will have a representative from Vidant here shortly if they're not here already. City of Greenville is here, the airport is here, Greenville Utilities are here as well, and whoever else comes in after that, we'll have them available for questions as well. So we're going to start off with Dr. John Silvernail, and he's going to give a brief overview of where we are as it stands right now.
Good afternoon, fellow Pitt County residents, response partners, and members of the media. This morning, we announced the first Pitt County case of COVID-19. We believe this case is related to travel and was not acquired locally here in Pitt County. This individual does work for Pitt County schools, specifically North Pitt High School. He was in the school building on Monday, March 9th, 2020, and Tuesday, March 10th, 2020. While we believe the risk to students and staff is low, we would encourage individuals who were in the building on March 9th and 10th to contact their medical provider should they develop fever or cough. The incubation period of COVID-19 is 2 to 14 days. We are now at day 10 or 11, depending on the individual's date of exposure. Most patients become ill within 3 days of exposure. So if you're not ill now, the risk of becoming ill is fairly low, but not zero. I'd like to move on and update you about the number of cases in North Carolina and the number of folks we've tested here in Pitt County. In North Carolina, we have 97 cases. We have 1 case here in Pitt County at this time. We have tested in Pitt County a total of 51 individuals. We have 1 positive result, the result that we released this morning. We have negative results are 11 at this time, with 39 tests remaining pending. Some additional thoughts. While the arrival of COVID-19 in Pitt County may be unsettling, it also marks our first step towards the eventual resolution of this situation. I do not believe this will be our only case and fully expect that we will have more cases in the near future. What can you do to protect yourself? Follow social distancing recommendations. Wash or sanitize your hands frequently. Cover your coughs and sneezes. Avoid touching your facial area unless your hands are clean. Avoid contact with sick people where possible. And stay home yourself if you are sick. Seek medical care if you feel you need to, but call your provider first so they can prepare for your arrival. Get plenty of rest, eat well, and exercise if you're able to. Feel free to walk and get outside in the sunshine, again maintaining those social distancing targets that we've talked about being 6 feet away from people if possible. Remember, our Pitt County Health Department has a hotline during the daytime for questions, and you can reach that number at 252-902-2300. That's 252-902-2300. We also have our dedicated coronavirus webpage at www.pittcountync.gov/coronavirus. Thank you.
Next, we're going to move on to Vidant.
Good afternoon. First, I'd like to say I appreciate the opportunity to give an update and the cooperation and collaboration across our communities to deal with this historic event with partners at the county and the city and across our region. I feel confident that we have the connections and communications to frankly respond in ways that many communities don't have the ability to respond. At Vidant Health, our mission is to improve the health and well-being of Eastern North Carolina, and that's the priority of the work that we are undertaking right now. The great news is that we have teams of professionals across all of our 29 county region that understand how to care for people with these kind of problems. Not only do we deal with seasonal flu that has many similarities, we deal with a number of similar conditions on a routine basis, and we have with the county over many years prepared and run scenarios that help us deal with the realities that we are seeing at this time. We are also informed by international, national, state, and local expertise to help us know what has happened in other communities and other healthcare delivery organizations, so we know what works and what doesn't work and the actions that need to be taken. Some of those you've just heard, but none of us can talk about this issue without talking about the important role that we all play in curbing the impact that this will have on Greenville, Pitt County, and Eastern North Carolina. And it's responsible of all of the citizens in Eastern North Carolina to listen to that message and to change the curve. So learn what flattening the curve means and do it. Because in Eastern North Carolina, we know what a big wave looks like. We do not want a big wave. We want to flatten the wave so we and our communities can deal with it. And so all of us play a role in that. So social distancing and the other items that you heard are things that we all need to take very seriously, and it will determine our capability to deal with the wave. So if we have everyone in Eastern North Carolina show up at Vidant Medical Center all at once, we won't be able to deal with that reality. However, the great news is that we have countless teams and professionals that have been working, frankly, for many weeks, knowing the wave was coming, to refine those plans and to modify them for the unique nature of this virus. And so every day we're informed by those external resources, by our own teams, and every day we are modifying and adjusting those plans to adjust to the evolution of this. And one of the evolutions that you've just heard is that we have a case in Pitt County. And that means that it's in the community, and those things that each of us can do become more important. And that patient is not in the hospital. So, and we have an opportunity, and we know that when patients get identified and they come in the hospital, we have a very defined processes to manage them and to take care of them and our other patients that aren't infected. So we feel confident that we have plans in place and that we can manage the patients and the capacity needs that we see in front of us, and we have a scenario for every eventuality. So we feel prepared. However, we meet every day to make sure of that fact. And so we appreciate everyone's assistance in helping us meet our challenge to improve the health and well-being of Eastern North Carolina.
I wanted to provide an update from Pitt Community College. The biggest thing that I would like to reiterate is that to our students and employees, if you would consistently check your campus email and the college's website for the most recent communications regarding your courses and how the college will operate. Going forward, we are limiting access to the buildings and reducing the number of individuals on campus. So if you do need to contact us, if you do need to come, please call or email first, as many of those questions can be resolved by those methods. Based on the recommendation from the North Carolina Community College System Office, PCC is suspending face-to-face courses for the vast majority of the programs and courses that have a lab component. Students, again, if you would, please check your email to verify the status of those courses. That said, we do have some programs that are critical to the health and safety of the community that will continue in small groups to finish up clinicals and labs. That said, any student that is concerned about their safety should contact their instructor for options to continue their coursework at a later date. Some courses, regretfully, will be unable to continue. Again, contact your instructors for information on how to continue those programs at a later date. For students that do not have a laptop and need one to complete their coursework, PCC is establishing a loaner program. That information will be available on the college's website shortly and under the student resource page for COVID-19. We do understand that these are challenging and unprecedented times. Your safety and well-being have and always will be at the forefront of our actions. As a community, we'll get through this together.
Double check the agenda. Next, we have written down City of Greenville. If you're ready.
Good afternoon. I want to start first by thanking all the folks with the Pitt County Health Department for what you're doing in our community to help educate folks on the COVID-19 virus and mitigate its impacts. This virus has now hit close to home for many of us, and I know that that may cause angst amongst our residents. However, I think it is more important than ever that everyone remain calm and realize that we're all going to get through this frustrating time together. The COVID-19 virus has indeed disrupted our way of life, but I want everyone to know that we are not helpless in our efforts to slow its spread. There's still a lot that each of us can do to slow down COVID-19, and while some may be drastic at times, it is important that we all work together if we're going to truly have an impact. It all starts with the recommendations for the Center for Disease Control and Prevention and our local health department on things that like personal hygiene, limiting public gatherings, and social distancing. But it continues in other ways. Let's flip the script on this virus and look for opportunities in these uncertainties that we face. Much of it can be done while adhering to the guidelines that we've been provided, but there are other opportunities as well. Think about what you can do to help your family, your friends, or your neighbors during this time. That could be as simple as out to check on them and offering to assist with any needs that they may have. Consider the continued support of local businesses that are being particularly hit hard right now. And many restaurants are still offering takeout service, or maybe you can purchase gift cards that can be used when normal operations resume. Or just take advantage of the beautiful days of spring. While many of our city facilities may be closed for now, all of our parks and greenways are still open. When you think about it, social distancing can still be fun, and these are types of activities that are vital for our physical and mental health. From a city standpoint, I want to assure everyone that we are continuing to provide city services. All city facilities, except for the G.K. Butterfield Transportation Center, may be closed, but we're encouraging those that are in need of conducting city business to continue to call us or use our website. Our city leaders will also continue to evaluate our current postponements of programs and closures of facilities to determine if additional changes will be necessary. If those changes occur, we'll notify everyone. In the meantime, let's all do the best we can to remain calm and positive through this trying time and recognize that if we work together from a safe social distance, this will all pass. And when it does, I look forward to our community thriving again. Thank you.
Finally, we have some brief remarks from the Pitt Greenville Airport, and then we'll go into questions.
And I'll just be brief here. Just want to let everybody know that the Pitt Greenville Airport does remain open, and we do plan to remain open, until we're told otherwise, that whether or not we can. Number one is that we have not had a reduction in services from American Airlines. We do anticipate that is forthcoming. We have had quite a reduction in passenger numbers as well as other activities at the airport. However, we are going to remain open. We're a very important life safety, asset when it comes to medical flights, especially with Vidant. We have had flights out there, and we want to maintain. We want to keep open for that, as well as just for the services. And we look forward to opening back up when all this is in the past. However, we are remaining open at this time, and that's really all I have to pass on. So thank you very much.
Okay, we're going to open up for some questions right now. In addition to the speakers you've already heard, we also have representatives from Greenville Utilities, Pitt County Schools, and the Pitt County Sheriff's Office here as well. So we'll open up the floor for some questions. Who would we like to talk to first? I'm assuming Dr. Silvernail probably first.
Hello.
From News Channel 12. Dr. Silvernail, can you give us a little bit more of a timeline of the patient who tested positive, as far as other places that he may have visited, where he went to actually get the test?
He traveled out of state. It was domestic travel. The weekend of the 6th, 7th, and 8th. He returned to work on Monday the 9th. Worked Tuesday the 10th, which was a half day for the students. He was not feeling well by the end of the day, called out sick on the 11th, sought care from his personal physician on the 12th, and was tested. The testing was collected on the 12th. It reported out early this morning.
So during that time, I guess, when did he quarantine, or what did that look like?
Once he, when he called out sick, he stayed home and had no contact with anyone. His physician followed the appropriate guidance and placed him on home isolation, and he has remained at home in isolation at home.
Beyond going to his physician, did he visit any other locations within the city or the county?
Not that we're aware of.
And then I also was curious to know, for you all at the health department, how many kits do you still have available?
Have that on the cheat sheet. We have 54 test kits on hand as of today.
Dr. Silvernail, can you explain the difference between a test kit and a sample kit? The test kits don't actually give results. I think there's some confusion on that point.
That's correct. The county manager is asking me to explain the difference between the actual test and the test kit. The test kit is a nasopharyngeal swab. It is a Dacron tipped, sort of like a Q-tip that is long and skinny, that is passed through the nose to collect a sample from what we call the nasopharynx, the back of the nose and the throat. And then it's withdrawn. It's placed in what's called a transport medium, a viral transport medium, and then sent to the laboratory. The laboratory then extracts that fluid and performs the test for the genetic material of the virus at the lab.
And as far as, I know ECU reported that he actually went to ECU Physicians to get that test. Is that correct?
That's correct.
Okay. Do you know which? I know that there's several different. Do you know
I do not know which one he was at.
Hi. Are you able to share the state that he went to?
He went to Georgia. He traveled to Georgia.
And can you tell us the nature of that trip? Was it a work trip?
It was a personal trip. He traveled to a conference which had in excess of 1,000 participants, we are told.
What kind of conference was it?
That was a youth conference.
Youth conference, okay. And during those 2 days that he was back at school before he called out sick, do we know anywhere else that he went other than his home and his work?
My CD staff are still interviewing him and doing the contact tracing, but as far as we know, he went to work and basically went home.
Okay. And for people who might have started feeling symptoms, what should they do when they want to get tested? What's the first thing they should do?
They should contact their personal medical provider to see if testing is appropriate for them, and their provider can usually provide that test. If not, there are other options, including the health department, and we will test. We are trying to reserve those tests for situations where people can't be tested in the more broad medical community.
Awesome. Thank you.
Okay.
So he's not being treated. You said he's being treated or just left at home, correct, the patient?
Mm-hmm.
Okay. So what is the plan of treatment for someone with coronavirus?
Well, the plan of treatment for someone, for everyone, is what we call supportive care, and that's a nice way of saying rest, drink lots of fluid, take something for your fever, and eat a healthy diet. So I spoke with him personally this morning. He doesn't feel the greatest, obviously, but he was breathing comfortably and resting comfortably at home. So.
And the other people that have been tested in the county, was it related to travel, or you know what their symptoms, or why they had to be tested?
They were tested according to protocol, which was that they had fever and cough and a negative flu test.
I think
Okay.
So involving that trip to Georgia, was it a school affiliated trip, or were there other students that go to North Pitt on that trip?
It was not a school trip. It was a private youth group trip.
Okay.
And
So no students from North Pitt were on that trip then?
that I don't know for sure, Tyler. We're running that line list, we call it, of contacts who may have traveled with him. It was a non-school related youth group trip.
Katie Augustine, Channel 9. Just a quick question. You said there's about 39 cases still pending, or tests, excuse me, still pending. Are there any other presumptive positive cases waiting to be confirmed by the CDC that you know of?
There are not, and the CDC is no longer confirming presumptives. Now that the testing has been passed down to the state and out to the commercial labs, they've done their own validation, so the samples are no longer going to the CDC for confirmation.
Can I ask how long typically it takes to get those results back?
Depends on the source. Initially, LabCorp, as an example, said 3 to 4 days. We found in this case that it was 6 days to get the sample back. The state laboratory is about 48 hours, generally a day for shipping. Sometimes we can get those back in as early as 24 hours, but the sample has to be taken to the state lab in Raleigh, and then it needs to go into the queue to be processed at the lab.
And so those tests that are still pending, has it been longer than normal?
No, they were in the window that we expect. A little bit longer than initially advertised. Still in that window. There's no real outlier there.
Okay, so there wouldn't be any reason for it to be taking longer?
No, well, there's lab capacity is limited still, and that's the reason that we're trying to be selective in who gets tested, because LabCorp can run about 1,000 tests, Quest can run about 1,000 tests a day. The state lab is somewhere in between 250 and 1,000. They haven't exactly put out a capacity, but the laboratory capacity is limited, so we're trying to reserve that limited capacity for folks we really need to know in. Okay.
A quick follow-up on the treatment. I know that he shows the symptoms, he's positive. I guess how long is this going to last for him, or is that all dependent on each different person?
That's hard to say. We're just, like I say, 3 months experience with this infection, so there's not a clear answer to that, Tyler. With the flu, if we were to say the flu, most folks are better in 7 or 8 days. With influenza, with this virus, we're not sure. We're still working that out.
And I know that question that I asked you on Tuesday, I'm going to kind of follow up again today, but we're hearing a lot about different trial vaccines and different drugs that are being used, and I guess could you give us a little clarity on kind of what that front is like and kind of where the medical field is as far as developing that?
Well, while there have been some optimistic results reported, I would caution you that most of these studies are not double-blind randomized trials. but there have been some of the anti-malarial drugs actually, which is unusual, that have reportedly shown activity. There is a non-FDA approved nucleoside analog. It's a fancy word for a medicine that looks like part of our genetic material that seems to be showing some promise. But these are being used not in double-blinded, controlled manners. They're on investigational new drug use and compassionate use. So we'll have to look at the data that comes out of those trials.
Thank you.
Okay.
For anyone else?
Oop.
It's just one more. Okay. So what is being done to prevent the spread in tight spaces such as the detention center?
Major, do you want to comment on that at all? Sorry to drag you in, Jeff, but I figured.
That's okay. What's the question again?
What is being done to prevent the spread in spaces such as the detention center?
Okay, let me just start from the beginning. February 26th, we put our infectious control protocol into place, our isolation protocol into place, and our enhanced sanitation protocol into place. We have barriers set forth at the detention center now, which of course we know what we've got. We want to make sure we don't get anything else. I can tell you that there are no symptoms at the facility, and of course absolutely no cases that I know of at present. No one's been tested. So the barrier that we've set forth at the detention center currently is that anyone that comes in will have a coronavirus screening as well as a temperature testing.
And are you practicing social distancing there also?
What was that again?
Is social distancing being practiced at the detention center?
What process again?
Social distancing.
Well, as you can imagine, anyone at the detention center, of course, we have a confined space. We only have a limited amount of space. So I guess you could think of it as if we try to isolate too much, it would become punitive. So we don't want to do that. So we keep an eye on each and every inmate that's actually in the facility, make sure that we're monitoring them upon our cell checks, make sure that they don't feel bad. If we do, of course, we'll isolate immediately. Have our medical team, which is a great medical team, take care of their needs. But isolation in a facility such as that, it makes it very hard. Mm-hmm.
While he's up here, any other questions for the major?
Okay.
Any questions left for Dr. Silver now, or do you want to move on to something else?
I'm ready to move on.
Okay.
Dr. Waldron?
Okay.
Tyler Harding, News Channel 12.
Tyler?
Just wanted to ask you about the supply stock that you all have at Biden as
Sure.
far as ventilators, respirators. What does that look like? Is there a number that you could put to that?
Yeah, well, we know what we have, and we track it, and we're really comfortable, and actually that we have new processes, and so it's a really moving target. So I know you want a number, but we're doing things that, from my 3-hour meeting this morning, that number's changed. So it gets complicated fast, but here we go. We are increasing the capacity by doing things that are very important, and the community needs to understand those. And frankly, I think it's important that, back to how I started this, how we all react to it becomes important. And I think you've heard that repetitively through this. So this is not operating as usual. So for instance, you may know that we are decreasing what we call elective or non-essential surgeries. So that opens up beds and ICUs and ventilators. So we're watching that line go down. So our census is actually a lot lower than it was a week ago. And so capacity is increasing. And then we have identified excess capacity across the region because we have 9 hospitals, and we can look at all of our hospitals as an integrated whole. And so we're working with the state to increase that capacity. So we have physical capacity that we're not licensed in many of our hospitals, so we got to get the state to say you can operate those assets. And so we have a significant amount of capability to, one, decrease the capacity utilization that we have right now, and then bring other things online. So we're very fortunate in that respect. And so I think that, you know, as we look at this wave, we can predict it. And so we are predicting literally weeks in advance, which we have been for weeks. And so we know that what's coming, and we're prepared to deal with it. And importantly, again, I think we need understanding from the community, and all of us have reiterated this. One, understanding why we take actions that we do to actually decrease the spread, and so the wave flattens. So we are restricting visitors, which is an inconvenience to our patients and their families, but it decreases the chance of spread. So we continue to push that down, and the capacity will change as it gets very complicated. So I'm just trying to be clear. So the testing issue that was described earlier, we are working to bring testing up, and we hope that we conserve testing, because if we can test people quicker, that allows us to have more capacity, because they're not consuming resources or being quarantined for things that they don't have. And so it gets very complicated from our modeling perspective.
When you say know what's to come, I guess, can you elaborate a little bit on that?
Sure. So we got a wave coming. And is it going to come, when I talked about the wave, is it going to spike? And, you know, think of it as a restaurant. If everybody in Greenville goes to one restaurant, there's no way they can accommodate that if they all go at the same time. And so what we want is, as this rolls across eastern North Carolina, we want the area under that curve to be slow and steady, so it doesn't overwhelm. I mean, we have limited capacity depending on how it hits, and so that's why the behaviors of the community, and I would really implore everyone to, you know, this is like food, right? I mean, if we all go to the grocery store, then we get stockouts or we run out of food. But the supply chain is fine, so the capacity to produce food and bring it to Greenville is fine. And so we've seen behaviors that will affect all of us if we don't curb those behaviors. And so if you have a fever and you even have symptoms that you're concerned about, but you're clinically okay, you talk to your doctor, and the advice probably will be quarantine yourself and stay, because if you come out, you'll actually increase the curve, and it's supportive therapy anyway. So that kind of thing. And so, you know, as was outlined, the steps need to be taken to contact your physician or your provider, and we're putting other assets in place to answer those kind of questions. But it really depends on how we all act.
And I'm just kind of going back to my first question.
Yeah.
I know that there is a concern across the country about the amount of ventilators and respirators. Can you kind of give us a ballpark figure of how many you know that you have that are available, or is there a number or anything that you could put towards that?
We have a number, and we feel like that we have the capacity to respond.
What precautions are you taking for your medical staff, the folks that are on the front lines of this, to ensure their safety and the safety of their families?
Well, I appreciate that question. So, it's so important, and I think it's important for all of us to remember the healthcare story we've been telling for many years. We have workforce shortages, and rural healthcare has been under duress for a long time. So, if that's a surprise to anybody, they haven't been watching the rural healthcare story for a long time, and I've been very vocal at a national and local you know, environments about that. So we are making this surge capacity happen on that foundation, and and our capabilities is dependent on people. So there are in rural North Carolina, there are physician shortages and other healthcare shortages, and so we have teams remodeling the process of care to be able to meet that surge and take care of people in a different model than we have before. So that work is happening, so we feel comfortable that we'll be able to take care of the surge, and at the same time design those processes to take care of the providers that have to go in to those environments to take care of those patients if they end up in the hospital because of this illness. And so we have redesigned a number of processes to be able to do that, and we've looked at all of the equipment and the other things we need to be able to do it. It is a daily discussion. I spend multiple hours every morning with all the teams reviewing the current data, and it is a very moving target for the type of equipment that you need, because we are learning from other people's experience, and so the CDC guidelines literally change every day on what type of mask you need to wear and those kind of things. So it is a moving target.
I guess, do you have a good quantity or supply of the mask and the garments and everything that's needed there? I know that's changing.
Yeah, I think it is changing, and we've evaluated the models and how it could hit us, and we've evaluated all constraints to capacity, and we have plans to meet the capacity demands, whether it's gloves, masks, people, ventilators, blood, any of the things that it takes to provide safe care, because that's what we do.
Thank you.
Any of the other agencies? Dr. Linker?
Hey, good afternoon.
Back over to Mike. So, with the employee testing positive, I guess what precautions are you taking on the school front, and what's the messaging you're sharing with those families that could be impacted?
So, on the school front, we've shut down the school earlier today. We'll go in tomorrow and do a major cleaning of that school all the way through it, and then leave it closed all weekend following the guidelines from the CDC, and we'll go that way. Obviously, this is, as Mayor Connolly said, this has caused a lot of angst amongst our people, as you could imagine. A lot of people went home today, just in precaution. We have a lot of people who have actually worked with that individual in the past couple weeks, actually about 10 days ago. So they are reflecting on their situation and follow the guidelines set that Dr. Silvernail talked about calling their physician, how they're feeling. At this point, we've not had anyone else say they were feeling sick, but obviously people would be worried.
And for this individual, this employee, over the course of those 2 days, how is there kind of an estimate of how many people they would come in contact with? That is a fairly large school, and
750 some kids, 780 kids in your system. When you're working a school like that, then you can come in contact with lots of kids.
I guess, so as far as the cleaning process of the school, are you bringing in a separate company? What are the details with that?
We have special supplies that are designed to clean this kind of stuff, so they're working and cleaning all the areas that you would touch, and all those sort of areas through the floors, the walls, phones, doorknobs, door frames, everything that would be touched, all the way from the one end of the building to the other, cafeteria to the gym.
I mean, essentially for having the school that's more than 700 students, are you kind of asking all of those? Obviously, we're practicing social distancing, but are you asking them to quarantine for the next 14 days?
Well, it's been 10 days already, and we won't be in school. If you're talking about the students, I mean, if you heard the governor today, then I don't know when we'll be in school again. It doesn't sound like we'll be in school anytime soon. So the staff are working in either small groups at school, or some are at home. Some are obviously working. We have child nutrition people who are working every day. They are in groups of less than 50, in most cases less than 10. The custodians are obviously working, keeping the schools clean. Teachers, teacher assistants, some are working at school, some are working at home. Same way with people in my office in this building, some are working at home. We've had more webinar type meetings in the last 4 or 5 days than I've had in probably the last 10 years. But that's going from everywhere, from superintendents across the state to all of our employees. So we are pushing our people our schools do not have staff meetings. Don't bring your staff into to the media center or something like that. If you do it in groups of maybe 4 or 5 teachers at a time, where you can actually spread out and do your social distancing.
And beyond the statement put out today, what is your message to that school group, to North Pitt High, the families there?
Well, obviously, our concerns are with the individual, and we are certainly, and I have had direct contact through his principal, and go from there. So.
Hi. Nikki with 7. I am just wondering, could you tell us? We know he's an employee at the school. Is he a teacher, or what?
I don't know if I should get into Dr. Silvernail. I don't really want, I think that that word is getting out who that is, and I'll let, that individual has also been contacting people on the trip that he was on. So I'll let him share that information.
All right, thank you.
Real quickly before we move on, I want to bring up the County Manager, Scott Elliott. We did have one question from an online viewer regarding size limitations for crowds, and specifically if Pitt County was going to be enacting any type of rules in that regard.
Pitt County will continue to follow Governor Cooper's pretty much mandate that we have crowds no larger than 100 or more. In terms of our board meeting, we will have a board meeting in this room next Monday, the 23rd. We're going to probably go with the CDC guideline of no more than 50 in a room. Obviously with that, we'll be in compliance with the governor's mandate, but I think the city of Greenville is following that same guideline for their meeting on Monday as well.
Any other questions for any of the other agencies here? Is that good? Everybody's good? All right. Thank you all for coming. I do want to, again, promote the coronavirus information page of our website, pittcountync.gov/coronavirus, or a Spanish version, pittcountync.gov/coronavirus-ES. And all the information delivered here today, as well as whatever will come forth after, will be posted on that page. Yeah, oh, and the hotline. 252-902-2300. That's a hotline of a phone bank set up at the Public Health Department for any questions in that regard too. Thank you all for coming.